comes to hormone replacement therapy, um, this is my personal point of view based on several years of practice, that number one, if we're considering using some sublingual bioidentical hormones as part of the therapy, I will always test through the lab to make sure that we have a valid reason for bringing hormones into the person's life. And so that's usually postmenopausal. So I'll look at the numbers, all three estrogens, progesterone, DHEA, testosterone. And based on that information, it's so simple and straightforward. You can get an idea of where we need to be and where we need to go with it. Some patients just have, their physiology has gotten so tired, and maybe the ovaries are just tired. I don't know how else to say it. If it's going to happen at all, trying to restore that person, it's going to take a very, very long time. So using some bioidentical hormone replacement therapy, within 4 to 6 weeks, they're going to feel a significant change, and it's going to probably be life-altering in a lot of ways. And so I'll do it. We'll bring that in. And I don't have a problem with it at all. Where any kind of hormone replacement therapy becomes a problem is when it's out of balance. And so the whole point of doing the testing and doing the therapy is to provide balance, because the balance is when you feel good. And so one of the primary reasons I ask a patient postmenopausally, they may have no symptoms, and I'll just suggest you might want to consider this test because of the idea that you may be out of balance, but you have no symptoms, but you could be driving cancer, other types of issues in the body. So, but at the same time, I might do some herbs at the same time we're doing the bioidenticals. And it's not unheard of for someone to be on a bioidentical for a period of time, and that gave their body a chance to rest. And that you would think that shuts down the hormonal system. Well, my experience is sometimes no. It actually allows the system to rest, and it'll restore itself to some degree, especially if we have some restorative herbs in or foods, something like that. So I don't see any sort of set way to do anything. Each person is completely different. Some people come in and they've seen something on the internet, or they're just really afraid of doing anything bioidentical. And I've been doing them for a decade and a half, and we've never had any problems. Well, a few people can be sensitive, so I'm not going to say that doesn't happen, that someone might not feel that good on them. It does, and no therapy is perfect, but we do the best to screen people and figure out who's going to do the best on them. Life was great when your own body, your hypothalamus pituitary, that whole axis monitors it for you. And once that's maybe compromised or gone, and you have to do it yourself, yeah, it's more of a hassle. But it's not good when you have zero vitality and you're depressed and you're anxious and those type of things, and you don't need Zoloft, you need some hormones. And so, no, I don't have a problem at all with that. But by testing, I can get an idea of whether or not just going on to herbal therapy and sticking it out for a while is going to be a great option, or if we really should interject some bioidenticals. It's always better to restore the glands, the organs, the tissues, and bring back health that way. But, we do live in a society where people want things yesterday. Yeah, and I can say that when you restore hormones through an exogenous source, it does help symptoms go away faster. There's no doubt about it. What we're trying to do would be heal old issues that your body couldn't handle over the years. And you've still got today's issues and tomorrow's issues that are going to come in. So if I could put you in a plastic bubble and isolate you a day away, we could restore it well and probably quickly, just doing more of a natural approach. But that's just not the reality of the way things work.